Welcome to the Luke Coutinho Show, where we can learn to reimagine our lifestyle. Antibiotics are critical for fighting bacterial infections, but they can also disrupt your body's natural balance, particularly in the gut. So many people across the world have to take antibiotics, some for the right reasons, it can save your life, and many people misuse antibiotics. We need to understand that if you are on antibiotics, in integrative and lifestyle medicine, you address the root cause. Number one, why are you sick? Number two, if you're on a medication, how do you manage the side effect of the medication so it does not create collateral damage? Every drug or medicine that you take has a side effect. These side effects are caused because of the primary drug, like in this case, we're talking about antibiotics. They deplete vitamins and minerals from your body. Even a slight change or a deficiency in a particular vitamin or many vitamins and minerals can lead to other collateral damage in the human body. So today we're going to understand how to manage the side effects of antibiotics. Of course, always work with your doctor to take the right antibiotic, never misuse it, never stop an antibiotic course in the middle without your doctor's permission. And if you've been prescribed an antibiotic for, let's say, a cold and a cough, and 3 months later you get a cold and cough again, and you think, hey, let's just take the same antibiotic, please don't do that. Speak to your doctor. Antibiotic resistance is real, and you need to manage it the right way. So what do antibiotics deplete, and how do we manage the side effects of antibiotics? Antibiotics, especially the broad spectrum ones. Broad spectrum means they kill both the harmful bacteria, which is good to protect you, but they also kill the beneficial bacteria, leading to several depletions in the body. The gut microbiome. Antibiotics disrupt the gut microbiome, reducing the diversity of beneficial bacteria that's needed for your immune system, needed to control inflammation, needed for several functions in the human body. And when antibiotics deplete these particular beneficial bacteria, they can cause long-term and short-term dysbiosis. It can impair digestion, you can have bloating, you can have acidity, lower your immunity, and it can even alter your mood because of your gut-brain axis. We have so many patients on antibiotics when they start to feel symptoms of depression, heightened anxiety, and we have to explain to them that it is because of the antibiotic and teach them how to manage the side effect of the antibiotic. Then we have to look at the vitamins produced by gut bacteria. Your beneficial gut bacteria synthesizes vitamins like vitamin K, which is essential for blood clotting. This is depleted by antibiotics. Vitamin K is also important for putting calcium in your bones. It's so important that you don't have excess calcium, flowing around in your blood. It needs to be put in the right places, and vitamin K is necessary for that. Another B vitamin that gets depleted is your B spectrum vitamins. You have B vitamins like B1, B2, B6, B7, and B12. All of these support energy in the body, brain function, and even red blood cell production. When you're on antibiotics, there is a reduction or depletion of your B vitamins by almost 20 to 30%. That's a large number. Antibiotics can impair the gut lining, reducing the absorption of minerals. So when you're on antibiotics, there could be inflammation in your gut lining, which reduces the absorption of minerals like magnesium that's required for your muscles, contraction, nerve function, energy. It can reduce the absorption of calcium, which is important for your bones and nerve signaling, and even iron. When this is a long course of antibiotics, it can even prevent the absorption of your iron, which is critical, as you know, for your oxygen transport. Most of our clients tend to have low immune systems after a course of antibiotics, so some patients are on weeks and weeks and sometimes months and months of antibiotics for certain conditions which they need to be on. And that's why it's critical to look at how you can help the immune system. Number one, why is the immune system getting weaker and weaker? Because of the depletion of all of these vitamins and minerals and basically your gut health. And your gut health is directly connected with your immune system. Short-chain fatty acids, also known as SCFA-SCAFAs, these are produced by gut bacteria. They're vital for your colon health, reducing inflammation, and maintaining the integrity of your gut barrier. Antibiotics unfortunately reduce Discover production, further affecting your gut and creating more inflammation, which is why some people feel bloated, some people have abdominal pain, and even your bowel movement can change. You can oscillate between constipation and IBS. So how do we counter these depletions? Do we jump straight onto vitamins and supplements, or can we look at foods as well as supplements? If you're on an antibiotic course, it's best that you work with your doctor to prescribe vitamins as well. And I would usually go with the supplements and also eat the foods rich in these particular vitamins and minerals, because antibiotics are powerful and you will need the assistance of your nutraceutical supplement. There's nothing wrong with supplements unless they're abused, they're the wrong quality, you take it at the wrong time, the wrong combinations, and if you misuse it because it just sounds great on the supplement bottle, but you don't really need it. So vitamin K, your doctor should prescribe you a K, especially a K2. You're looking for a vitamin K2, which is more bioavailable. If you're looking at foods, it would be a leafy green spinach, your vegetables, which are leafy greens, and you would want to lightly steam it, saute it. You would like to cook it a little bit. And then you have a very powerful food, which is called natto, and this is made from fermented soy. It's one of the highest sources of vitamin K2. So you can do a supplement or you can do food, you can do both. Then B vitamins. Your doctor should be putting you on a B complex supplement, which has a 100% recommended daily allowance. You should have your B1, your B12, and all of your B spectrums. You want to look for the methylated version of your B12 always, and your B complexes for better absorption. If you're looking at real food that contains your B vitamins, you have your whole grains like your brown rice, your oats, eggs, nutritional yeast, and fermented foods like miso also provide B vitamins. Another vitamin that gets depleted, which affects your immune system as well and your bones, is vitamin D. So your doctor will put you on a supplement for vitamin D, and mostly 1 in 2 or 3 people have low vitamin D levels anyway, in general. So if you put on antibiotics, your levels are going to fall further. It's extremely important for all of us to live with our vitamin D levels within range towards the higher side, but not crossing the higher side of the range, because vitamin D can then be toxic to your kidney. So of course you want to get sunlight, and then you have fatty fish like salmon, you have egg yolks, and you have mushrooms, you have sprouts, but that's in a very, very small quantity. So mostly you need to supplement and get your sunlight. Now that's the vitamins. The minerals that get depleted are magnesium. So being on a magnesium supplement like a glycinate would be better for absorption and less upsetting to your digestive system. If you're looking at real foods that contain magnesium, there would be almonds, there would be cooked spinach, and there would be pumpkin seeds. Calcium also gets depleted, so your doctor would either give you a supplement, but remember you should always take your calcium 2 to 3 hours apart from your antibiotic, as calcium can interfere with the absorption of quite a few antibiotics. So you just want to be safe and take your calcium supplement 2 to 3 hours after your antibiotic. And of course, you can get it in real food like your dairy, like your yogurt, and your leafy greens like your kale, spinach. Iron. Usually a short course of antibiotics will not really create any issue in your iron absorption unless your gut is already weak. Unfortunately, a lot of people already have inflamed guts, and if they now have to be on antibiotics, there is a huge chance that they are not absorbing iron the right way. So through your lab reports, your doctor will determine if your iron levels are low, and then they will supplement you. Or of course, you can look at real foods like lentils, spinach, again cooked, and if you're non-vegetarian, red meat would be one of the best sources. Other nutrients that get depleted and further weaken the immune system is zinc. And zinc supports the immune system for recovery. So when you're on an antibiotic, your doctor would either give you a zinc tablet, or you would take the nutraceutical. And real foods, you would find it in pumpkin seeds, being a high source of zinc, and oysters if you're non-vegetarian. And if you're vegetarian, it would be chickpeas. That would be your chana. That would be great as a source of zinc. So as you can see, many doctors would probably give you a multivitamin. I'm not a huge fan of multivitamins because people take it continuously, and in small quantities, these cumulatively build up in your system, and some vitamins are fat soluble, and if they get too much in your body, they get toxic. So I'm a fan of using a multivitamin prescribed when you are on antibiotics. Another very important thing are your probiotics and prebiotics. Now, there's a lot of new research and science, and we're seeing that happen, and we're trying this out with our patients, and it's working really good. For the longest time, we were trained to give probiotics with antibiotics. And there's no problem. You can still continue with that. But what's going to be more powerful than the probiotic is actually the prebiotic. So let's quickly talk about probiotics. Your doctor would give you a supplement, okay? And this is absolutely required to help you replenish your beneficial gut bacteria and maintain your gut integrity in the gut. It's best taken, again, 2 to 3 hours after your antibiotic. Your doctor could give you a 10 to 50 billion CFU per day. It's up to him based on the kind of antibiotic. Again, I want to remind you to take your calcium supplement or eat your calcium-rich foods and take your probiotic if you're taking one 2 to 3 hours apart from your antibiotic to avoid interference of the absorption of your antibiotic. Now, what are prebiotics? These are non-digestible fibers that feed the beneficial bacteria in your gut, promoting their growth. And this is why it is actually more powerful than a probiotic, especially when you're taking antibiotics. So prebiotics are kinds of fibers, like you would find them in inulin, FOS. They increase the SCAFA, the SCFA, that's your short chain fatty acid production, supporting your gut barrier health, reducing inflammation during and post your antibiotics. Now, prebiotics would be better for long-term gut health, as they actually help sustain the growth of good bacteria over time. So you can look at foods. Let's go quickly through the foods that can actually help you. Probiotic-rich foods would be your yogurt with your live culture, kefir, sauerkraut, kimchi, miso, kombuchas. These are all great probiotics for you. And if you're looking at prebiotic-rich foods, this would be garlic and onions. They contain inulin and FOS. So you can have this before your meal. Asparagus, you would have bananas, and you would have your whole grains like your oats and barley. Barley has a great amount of beta-glucans and resistant starch, which actually helps you with your overall gut. The additional tips while you're on antibiotics: you want to stay hydrated. You want to reduce your inflammatory foods like sugar, alcohol, refined bakery products, refined saturated fats. So your deep fried French fries, outside food for a while. Of course, like I always say, you want to manage your stress levels because chronic stress can hinder gut recovery. You should know by now that chronic stress can actually reduce the efficiency of how your gut works. You want to sleep well, maybe 7 to 8 hours of good quality sleep, because poor sleep disrupts the gut microbiome and hence your immune system. So it's always important to take your probiotics 2 to 3 hours apart from your antibiotics, and your calcium as well. Your B vitamins can be taken anytime. They're water soluble. And the big question is, when do you stop taking this? After a course of antibiotics, you want to continue with these vitamins and minerals that we spoke for at least 4 to 8 weeks. Or maybe you want to take the vitamins and minerals if it's in a supplement form for about 4 weeks, and continue eating rich foods that are rich in these vitamins and minerals for at least a whole 8 weeks. It's extremely important for immunocompromised individuals to realize that you should take probiotics under the supervision of your doctor, because in certain cases it can actually weaken your immune system. Secondly, when you're on prebiotic foods like your garlic, your onions, and these fibers that we spoke about, if you have IBS or you're already on a low FODMAP diet, you're FODMAP sensitive, you may experience bloating, so then a prebiotic fiber may not be the best for you. So these are quite a few vitamins and minerals. These are the foods which are common that you can use. And like I said, your doctor can prescribe these vitamins, minerals, probiotics, prebiotics, or he may just give you, or she may just give you a multivitamin, which you can take for 4 to 8 weeks and then stop it post that. It's extremely important to understand that an antibiotic can save your life. Over 13 years of consulting, I've seen too many patients ruin their health by not wanting to take an antibiotic for the right reasons because they were scared of it or they just didn't believe in allopathy. It's important to understand that, yes, we respect nature. Nature is powerful. We would all like to naturally heal in a real world. But sometimes you need a particular drug or a medicine that can save your life. I've seen patients not take the antibiotics. I've seen patients stop the antibiotic in between the course because they felt better, only to have a relapse later or to become antibiotic resistant. So it's extremely important to understand that you always integrate nature, lifestyle medicine with your conventional or allopathic medicine. This is how you manage the side effects of your antibiotics. I've seen too many people take antibiotics without balancing the side effect of the medication, and they go on to have weaker guts, inflamed guts. They're immunocompromised. They start to have bloating problems, extreme gut problems, which further lead to hair fall, dull skin, and other issues. So there's always the right way of doing it, and then there is the wrong way of doing it. Remember to make notes and put this into practice. Action is everything. Consistency is gold.
Stay tuned for more. We're going to continue our journey, learning, sharing, and evolving.